name is Kat Brooks. I'm a stoma care nurse. I have done this job for 7 years and I've been in colorectal nursing for over a decade. And I really love where I work and I love working with patients and guiding them through a really difficult part of their lives. I met a young gentleman, I think he was about 20 or 21, in a post-op clinic, meeting him for the first time. He'd had surgery in a different county. He came in wearing quite an old-fashioned styled clear product, and I sort of questioned him a little bit as to why he'd chosen that, just sort of anecdotally, because a lot of patients in the early stages of their surgery, they would like to have a non-clear bag pretty quickly, just because it's a bit of a reminder of sort of being unwell. Didn't realise that there was any other choice that he could make. He didn't realise that there was another bag he could use. It was quite a big bag. It was sort of hanging down over his under his t-shirt. So I got him some more modern products. He really was drawn to the Confidence B. I think he really liked the fabric. I think he really liked the fact that it was black because it mixed in quite well with his style and his clothing. And he really liked the opening because also that was dark as well. So he didn't, again, have to look at anything. And he found the opening really easy to use. He really enjoyed sports and he felt like that would really fit in when he was at the gym. He also really liked the fact that it had a waterproof filter, which the other ones didn't have, and he didn't realise that the filters would get blocked with water, whereas this one didn't. He left quite positive and was going to come back to me a week later. He did. He got on really well with the newer style products and you could see a real change in him. He's had a really, really big lift, and I think it really helped his recovery psychologically and physically, that he could kind of find a product that really, really worked for him. I think Confidence B has had a huge impact on the market. I think it came at a time when a lot of companies were trying to be innovative, but this one sort of went a bit above that. They worked on every aspect of the bag. It's got a really thin flange, it's got really good colours, and a lot of that was lacking in the market, especially in terms of diversity and fabric choices. It just felt much more modern, and also it doesn't have as much noise quality, so that's one of the aspects that's really important to patients. The waterproof filter is the only one on the market, so for people that swim, that's fantastic because then they don't have to fiddle around with stickers, they don't have to change their bag immediately. The bag wears really well when it does get wet, so especially for younger people, if they're looking to go abroad, you just knew that it would be a really good product that you could give to patients. And I think once it launched, me and my colleagues were all sort of had in our heads a little list of people that we would want to send it to, a list of people that you knew would love it and that we wanted to sort of give them that brand new one and then get their feedback on how they felt about it, and then we could give that to other patients as well, just to help us expand, you know, any new product. We want to give it to as many people as we can, just because if it can make them feel a little bit more confident, then that's our goal really in our jobs. Confidence B has really helped me give a lot more choice to a lot of patients. So we obviously have patients that come from lots of different diverse backgrounds. I'd probably be quite embarrassed to give sort of like the beige type products to some people from different backgrounds, because it really does look like the only people in the industry are supporting are those of a certain colour. The fact that these are linked with sort of more underwear colours, and most people wear black or white underwear, I think that will give them confidence, the fact that it will blend in with something and give them more confidence. I have been a stoma nurse for 7 years, and there's been huge amounts of changes in terms of social media and different platforms and things across that time. And I think it's really, with that development, it's also really reflected in patient confidence, that they can find people similar to them, with similar interests to them, and it doesn't make them feel alone. Especially having some really positive stoma influencers on social media is really fantastic. Confidence B and Salts have got a really good platform for that, and they sort of tweeting things and retweeting patient stories and things like that have been a really positive impact, and I always steer people towards certain social media influencers so that they get the right kind of impact, because the internet can be really damaging, especially if they're pre-surgery, if they're looking at stomas. If you just Google stoma, it comes up with lots of different things that might not be correct, might not be relevant. So steering people towards the right kind of influence is really important part of my job.